Hello, my name is Li Cheng. I'm from the first affiliated hospital of Kunming Medical University in Yunnan of China. I'm the head nurse of the breast surgery department. Today, I'm honored to share a study with you. The topic is effectiveness of expressive arts therapy among female breast cancer survivors. That's a randomized controlled trial. Now I will report from the following 5 aspects. First, the study background. According to the 2020 China Cancer Statistics Annual Report, the incidence rate of breast cancer in China is increasing at 3 to 5 per annum. It has become the top killer of women's health. Although mortality has gradually decreased, due to comprehensive measures, research shows breast cancer still causes numerous survivors suffering the symptom cluster, including pain, anxiety, depression, which results in poor quality of life among them. Therefore, change from palliative care to chronic NICE is of vital importance among breast cancer survivors. What is expressive arts therapy? English abbreviations EAT. It is a kind of treatment method that takes the form of artistic creation as the medium to express inner feelings, helps the expression of individual emotions and emotional expression in the process of creation, and aims to promote the communication between patients and others, improve symptoms, pain, and social functions. It includes painting, music, dance, handmade games, and so on. EAT as an efficient method to alleviate symptoms through self-expression, stressed by many researchers in recent years. The study aimed to compare the effectiveness of EAT on psychological, alleviate body and psychological pain, helped the survivors return to society as soon as possible, and last, establish a characteristic development model in the tumor nursing care. Secondly, the study methods. This randomized single-center patient-blinded trial was carried out at a tertiary comprehensive teaching hospital in southwest China from November 2018 to March 2020. The study are following the guide of the consort statement. The hospital's research ethics committee approved the study, and informed consent was obtained from every participant before carrying out the study. The inclusion and exclusion criteria are as follows. Patients in the control group, English abbreviations CG, received the conventional interventions in each chemotherapy cycle, including health education ranging from physical activity, medicine taking, diet arranging, follow-up after discharge. Patients in the intervention group, English abbreviations IG, received EAT in addition to the conventional care. The EAT included 6 sessions of 60 to 90 minutes and was performed by 2 instructors who have received the practice of EAT and training of related theory. They are held in a quiet, well-lit room with participants seated in a circle as shown in Figure 2. There are examples of artwork created by patients during EAT programs. For example, datura painting, dancing, flower arrangement art, volunteer party, manual paper cutting, and other art forms with Chinese characteristics. Psychological distress and the quality of life as two leading indicators were used to reveal the efficacy of EAT intervention. Demographic characteristics were recorded at the beginning of the study. Psychological pain was evaluated by the distress thermometer (DT), while the quality of life was evaluated by the QLQ-C30 questionnaire. Both of them were evaluated after the intervention. Next is questionnaire on quality nursing service in our hospital to evaluate patients' satisfaction with our service. After the study, our nurses received thank you cards and flowers from the patients. Data is managed by Epidata3 software and then imported to Sparse 26 for analysis. The continuous variables are expressed as mean plus or minus standard deviation, while the categorical variables are expressed in percentage. For continuous variables in the normal distribution, the independent samples t-test was performed to analyze differences between groups. If abnormal, the Mann-Whitney test was used. For categorical variables, the chi-squared test was used. P-value less than 0.05 was considered statistically significant. Thirdly, the study results. Initially, 170 female breast cancer patients showed interest in participating. After screening for eligibility, 151 met the criteria and were randomly assigned into two groups. The number of intervention group is 77 and the other is 74. 10 patients in the CG dropped out in the study period due to health issues or economic issues. Most participants were married and had a harmonious family relationship, with a median age of 46 years. The demographic characteristic of participants is summarized in Table 1. There are no significant differences between groups in any of the parameters at baseline. Table 2 shows that the scores of DT are 4.64 plus or minus 2.21 in the CG and 2.10 plus or minus 2.04 in the IG, with a significant difference in statistical analysis, p less than 0.05. After the EAT sessions, the IG presented significantly greater improvement than the CG in emotional, cognitive, social functioning, fatigue, pain, dyspnea, insomnia, appetite loss, constipation, diarrhea, and global health status, but there is no significance in physical functioning, rural functioning, nausea and vomiting, as well as financial difficulties in either group. Table 3. After the intervention, the patient satisfaction in IG was significantly higher. Chi-squared is 16.554, p-value less than 0.05, shown in Table 3. Fourthly, the study conclusion. For cancer patients, EAT is an excellent psychological intervention method because non-pure oral communication skills do not stimulate the patient's defense mechanism. Therefore, they can review the subconscious, participate in and Master the psychological adjustment methods naturally. It can help patients reduce psychological distress and improve their ability to deal with cancer and quality of life. Moreover, it can also enhance the relationship between nurses and patients. At last, the study prospect limitations. Firstly, a small number of samples and the representation of the samples is not enough. Secondly, the research period is short. Therefore, further studies and long-term follow-up are needed in the future. The advantages of EAT need to be further studied. We will continue to pay attention to the psychological problems of patients and focus on more personalized and effective interventions so as to promote the development of tumor psychological nursing. That's all. Thank you for your listening and invitation. Best regards. Goodbye.